Hi, I'm Julie Fitzwater, and I am in the PhD program in nursing education at the University of Northern Colorado. And today I'm talking with Kimberly Kintz. Kim, could you please tell us about your current position in your nursing career?
I am an associate professor of nursing in the pre-licensure program at Linfield College in Portland, Oregon. And I have been teaching here for the last 6 years full-time. And prior to that, I taught as an adjunct for a year.
So please tell us about your nursing work and your career, and how did you come to your current position and the area of research that you're working in?
Okay. So I actually was a student here at Linfield College and graduated from Linfield Good Samaritan School of Nursing in 1987 and practiced as an RN for 10 years. I practiced in med-surg. And then after that, I had decided that hospital nursing wasn't what I wanted to do, and I started working as a home health nurse. And I worked as a home health nurse for 9 years. And during that time, I also worked as a wound care nurse and helped set up an outpatient wound care clinic at one of the hospitals in Salem, Oregon, but still running today. And during that time, became certified in wound care as a certified wound care nurse, and also certified as a community health nurse. So I did that for 10 years, but while I was in nursing or practicing as an RN, I decided to go back to graduate school and went to get my master's in nursing and a nurse practitioner. And in 1997, I became an adolescent adult nurse practitioner and practiced as an NP in internal medicine and primary care for 14 years. And I did that full time, and I loved it. I loved patient care. But I also had always wanted to teach. And so I had decided at that time it would be a good time. My children were older, and it would be a good time for me to make a change. And so I started out small, worked as an adjunct for a year just to make sure that I knew what I was getting into. And I did, and I loved it. And so I did that for a year. And after 1 year, applied to the doctoral program at Oregon Health Sciences University, and also applied for a full-time position at Linfield College, the tenure track, and have been doing that for the last 6 years. I finished my doctorate in nursing practice from OHSU in 2013.
Great. How would you describe your work in the nursing and healthcare field?
So one of the things in the doctoral program, we did a clinical residency. And so what I had chose to do was work at the prison, at the men's prison in Salem. And it was a really good experience. It was an eye-opening experience. I was exposed to healthcare disparity at its greatest. And it really had an impact on my career trajectory after that. So I was there for a year, did the clinical residency for a year at the men's prison, and that work there carried over into the work that I'm doing at Linfield as well, in the nursing, the School of Nursing. So I've been lucky to have participated in some Jan Term Abroad programs through the International Programs Office. Linfield College, 67% of our students study abroad, and many of our nursing students, the opportunity for them to study abroad is during the Jan term. So it's the four-week intensive where they can choose whatever program or interest they have, but many of our nursing students choose a nursing program. And so Dr. Henny Breen and I have developed a service learning course in Peru, and we've also developed a service learning course in Cameroon. But the service learning course in Peru is much more structured, and we worked in collaboration with an NGO, a non-governmental organization here in Portland, Oregon, Health Bridges International. And they've had their foot in the door in Arequipa, Peru. And we also then collaborated with La Catholica University in Arequipa, Peru, their School of Nursing.
Okay. So tell me about the research that you've done with these experiences.
So when we were doing the service learning, the first course that we did, we were thinking, what kind of an impact does this have on the students? And their career trajectory. Are they, if they participate in a service learning course, are they then more likely to work with underserved populations in 5 years or 10 years? And so we started doing qualitative and quantitative analysis. We did a mixed study starting last January of 2016, asking students questions, and we have a set of questions that we ask them. And then the other thing we have them do is keep a journal. And so we're looking at for themes, about their experience, at least when they're in country. And then we're also 4 or 5 months later doing a survey using a tool. So we're doing a survey pre and post country surveys. So that's the mixed method part. And our plan is then to do a longitudinal study to follow up with these same students in 5 to 10 years to see where are they in their career trajectory. Are they more likely to work with underserved populations?
What are some of the significant findings that you've had?
It's been very interesting. We worked in collaboration with Health Bridges International and the Catholic University, their nursing faculty. And also the study includes American and Peruvian nursing students. So it's not just the American nursing students, but the Peruvian nursing students as well. So do these experiences, these service learning experiences, impact their career choice? Because many of the Peruvian students, like the American students, feel like the only place nursing care takes place is in the hospital setting. And so trying to open their eyes to the fact that nursing takes place everywhere. And community health and population health nursing are a really important part of that. Some of the findings from the survey, at least initially, have shown us that really there isn't a difference between nursing students in Peru and nursing students in the U.S., that their goal for their patients are the same. That they are looking for positive healthcare outcomes. Accessing care is one of the issues as well. So in Peru, we do have problems with accessing healthcare in the U.S. In Peru, the access to healthcare is a little bit different. It's more geographical. So if you live in the center, and Arequipa is the second largest country in Peru, or the second largest city, in Peru, but there are many outlying cities and villages where people don't have access to care. And so one of the things that we did while we were in Peru was had health fairs in collaboration with the Catholic nursing students, and then the American nursing students doing health screenings and identifying people at risk, and then helping them then find access to care or connecting them with clinics that are either local or helping them with transportation. So doing some of those population health kinds of.
I'd love to hear about the impact that this research has had on students.
So the impact that it's had on nursing students is that it causes them to be reflective, not causes, but it helps them to be more reflective about where they're at and all of the things that are going on around them that they can't change or can't control, because in the hospital setting it's different because you're in control of your environment. Whereas in the community or in the community, it's not as easy to control your environment. Your environment controls you. So, and also using resources. What kinds of resources do they have available to them, and then using those resources, albeit limited, but using those resources to get what they need. And improvising. Times that they've had to use their resources or improvise when we were doing checking capillary blood glucose, so assessing for diabetes, and we didn't have a sharps container. And so what they had to use were plastic jugs. And so they used the plastic jugs they used lancets in there, but then they also used the plastic jugs to put their dirty gloves, take them off inside out and then just put them in there and then go wash their hands. So thinking outside the box or thinking beyond, I need a sharps container and I need a red garbage bag because that's infectious waste and those kinds of things.
I love that. So nursing students really being able to think differently based on this experience. So how does this experience and the research that you're doing relate to state and national policy and priorities?
So I think what it does is it identifies or brings a light to the gap or the healthcare disparities and social determinants of health. And it also helps the students see what healthcare disparities are and how they impact healthcare outcomes in individuals and in populations. And I think it helps them to look at what they can do as nurses to advocate for their patients, whether it's on a local level, working for, or being a member of their local nursing organization, or on a national level, American Nursing Association. So being involved and looking at policy, healthcare policy, how do these policies then impact their patients' access to care or ability to get medications.
And is there much in the science of the kind of research that you're doing?
No, there isn't a lot of research currently about the impact of service learning, so we're pretty excited about looking at service learning and the impact it has and whether it does have an impact on students and their career trajectory. Anecdotally, we've heard from students who graduated. We took nursing students to Cameroon in 2013. And those students have been practicing for a couple years, and just anecdotally, they still talk about the impact that that experience has had on them as a nurse in their current practice.
What kind of advice do you have for the next generation of nursing leaders?
Be open to opportunities. Be open to opportunities because you never know what kinds of opportunities will mushroom. An example of that is with working in Peru at La Catholica. I'll be doing my sabbatical there. So this was, it was a great opportunity for me. It wasn't anything that I had planned, but it's an opportunity for me to collaborate with nursing faculty in Peru, and also mentoring. Or one of the things that I'll be doing is I teach pathophysiology and pharmacology here at Linfield College, and so currently at La Catholica, there pharmacology course is taught by a pharmacist. And the nursing faculty and the students have expressed that they would like to have a nurse teaching pharmacology. And La Catholica asked me if I would help them develop that course and mentor a faculty to teach pharmacology. And I'm helping some pathophysiology because I like that as well. So being open to opportunities and not closing doors or thinking you might not like something. You never know.
Great. Well, thank you so much for your leadership and your interesting research.
Thank you.